crime. What's the story? Exploring the link between public health and crime in relation to alcohol. How do we consider both perspectives? And this is really important to me because it's the crux of my work that I do. And I'm hoping that I can get you to see that. So I'm Dorothy Newbury-Birch. I'm Professor of Alcohol and Public Health Research at Teesside University, where I lead a team of about 35 researchers and PhD students. And we do a lot of work around public health and mainly around alcohol, but we also look at other areas. I'm also a visiting professor at LPU, and my Twitter, if you want to follow us, is .birch or Team Alpha T's, it should say there. And that's my email if anybody wants to email me. Now, as some of you may know, I've been across to the lovely professional university twice. I've been to India nearly 30 times. I'm so sad that I'm missing Holi this year. But I was at your lovely university a year ago this week, before we knew what was happening with COVID, and I had a lovely day there. It was very tiring because I came up from Delhi, and you can see I met Preet and I met Supriya, who have become good friends of mine now. And I had a lovely day learning a lot about what you do. And of course, like everybody from England, I love Holi. And as I say, I'm going to miss it this year. So I want to talk to you about alcohol. I'm really aware that I can't see you all when I'm sharing the screen. So if something goes wrong, you're going to have to tell me as opposed to writing it down. Okay, so in England, this may come as a shock or not a shock to you, but the cost of alcohol to society in England is around £21 billion a year. And that comes a lot from alcohol-related crime, lost productivity through unemployment and sickness, costs to NHS, plus other costs to health services and everything else. Just for those of you that don't know, a pound is round about 100 rupees, roundabout, just to make it a bit easier for you. And what we know is for every £1 we invest in alcohol treatment, £5 is saved on health, welfare and crime costs. But at present in England, that isn't happening. There's more and more cuts to public health services, which is where alcohol treatment comes from. Before we go ahead, I just want us to think about the benefits of drinking. I don't want this to be a lecture that says none of us should drink. I mean, obviously for religious reasons or for whatever reasons, you know, a lot of us don't drink. But it isn't illegal in England for over 18s to drink. Actually, it's not illegal to give a child over 5 alcohol, but it would be a safeguarding issue. And for a lot of people, going out, having a night out, meeting with friends, having a drink is seen as a positive thing. You know, for a lot of people, they don't drink too much, they have a couple of drinks and, you know, they feel a bit relaxed. And I think I'm not one of those people that say we shouldn't drink at all. I think we just need to be aware of the risks of it. And of course, we know about the J-shaped curve. Now, the J-shaped curve tells us that the more you drink, the more likely you are to die of something related to alcohol. This is an old slide and it's used a lot, but since I've become an academic, I've always questioned why drinking nothing is higher than drinking 1 unit. So you can see at the front end of this scale, you know, the relative risk is higher for those that drink nothing than it is for those that drink just 1 or 2 units a day. And I've read so many papers on this, and I've done a lot of work around this. And the thing I've concluded from this slide is that actually we don't know within the people that they used for this study, whether or not the people who were drinking nothing had previously been heavy drinkers. It's really hard to measure when we're looking at people who have drank before but don't drink currently. So if we ask over the last year, have you drank, how much have you drank? Some people would say no, but they have previous issues with alcohol. And it's important for us to really think about what data is telling us. Now, it may be that moderate alcohol consumption has a cardiovascular benefit, and between half a unit and 1 unit per day may be protective. This is not as clear as it looks. The only group that this is shown to be beneficial to is postmenopausal women. So when you read in newspapers that actually a glass of wine a day can be helpful for you, this isn't true. It can be helpful for specific groups, and even then, I think we need to be careful about that. So alcohol is a major public health concern around the world. I don't think any of us disagree with that. It's the third greatest risk to health worldwide, and the second greatest risk in high-income countries. It accounts for nearly 4% of worldwide deaths and 5% of deaths in young people. And that's different in different countries, in different areas. And that's an old study, but it still holds true today. And I think a lot of us don't realise that alcohol has been identified as a causal factor in more than 60 medical conditions. In the UK, we're doing a lot of work now around the links with cancers. So we hear about pancreatitis, we hear about liver disease, and we hear about cirrhosis of the liver. However, lots of us don't know that it has an effect on depression, stroke, heart disease, anxiety, and all sorts of livers, so all sorts of cancers. So there's a lot of work being done at the minute about how we can get that message across to people. And of course, when we look at the criminal justice and public health framework, it becomes really easy to see how crime and public health fit together in terms of alcohol. So the easiest way to say this is if somebody gets arrested for getting into a fight, that would go through the criminal justice system, but it's also a public health issue because they may end up in hospital getting stitched, or they may end up, with mental health outcomes because as a result of that. Now, this isn't as easy as just looking at it on a screen like this. There's all sorts of issues that come into play with this, not least socioeconomic issues. And of course, when we talk about India, that comes into effect, and I'm going to talk about India a little bit as we go ahead. So what is a unit? Now, most of us don't know what a unit of alcohol is. So in England, in the UK, these are this is the information that we give out. So lots of wine drank in England. So a bottle of wine is roughly 9 units of alcohol. A shot of spirit, and that's just a single shot, will be 1 unit of spirit. And you can see that it gets a bit complicated when we're looking at small glasses of wine, medium glasses of wine, and big glasses of wine. For bottles of things, we've got to be really careful. So bottles of beer are about 2 to 3 units. It's not shown on there because we've just got pints. So it's really complicated for people to know, but just having this rough idea is helpful to everybody. So what do we class as somebody who has an issue with alcohol? Well, we call them alcohol use disorders. Just to let you know, we don't use the term alcoholic anymore. We use the term, and that's across the world in the academic field, we use the term dependent on alcohol. which is a much easier way and much better way of being inclusive to people. And we